Welcome to the Diamond Place and Resilience Reimagined. Hi, I'm Tiffany from the Diamond Place. Today we're going to talk about something you've probably heard about on podcasts, TikToks, or in group chats. Mushroom therapy, which is also called psilocybin assisted therapy. And I want to say this up front. This topic brings up hope for a lot of people. And it also brings up fear, skepticism, and a ton of questions. So we're going to slow it down and make it simple. This is not medical advice, it's education, so you can feel informed and safe while you decide what's right for you. What is psilocybin in plain English? Well, it's a natural occurring compound found in certain mushrooms. When taken, your body converts it into something called psilocin. This changes how your brain communicates. These systems are connected to your mood, your memory, fear responses, and your sense of self. When doing mushroom therapy, the goal isn't to trip for fun. The goal is to create a brain state that is temporary so that you can process your emotions, memories, and patterns differently. It should be noted that researchers are still mapping out the exact how, but psilocybin affects serotonin receptors in the brain, and this can temporarily disrupt rigid patterns of thinking, which could be part of why some people report feeling unstuck. Let's talk trauma for a second. Trauma isn't just a memory, it's often a pattern in the nervous system, which looks like hypervigilance or shutting down, panic, emotional numbness, looping thoughts, or feeling unsafe even when you are safe. So when people hear that psilocybin might help depression and distress, they naturally wonder, could it help my trauma too? Here's the honest answer. Strongest research evidence so far is for depression, especially hard to treat depression. For PTSD specifically, psilocybin research is still emerging and not as defined yet. If you've experienced trauma, this is a go slow topic, not because it can't help, because it can open up a lot. Let's talk benefits without the hype. There have been clinical trials for treatment-resistant depression, and these trials, a single supervised high-dose session has shown meaningful symptom reduction for some people. And in one major trial, a higher dose performed better than a very low dose. Over a few weeks, those side effects also occurred. There are also trials showing reductions in depression symptoms. What people commonly report is they are able to feel emotions that were stuck finally start to move. Compassion for themselves instead of constant self-blame, being able to see a painful memory with less terror attached. And they found a sense of meaning, perspective, or reconnection, as well as reduced depressive symptoms for a period of time. I want to make sure you know that it's not just the drug, it's the combination of the experience plus preparation and integration, so like support before and after to make sense of what came up. Okay, this is the part I never want anyone to skip. Psilocybin is not gentle for everyone. Even in clinical research settings, common side effects included things like temporary anxiety or panic, headache, nausea, emotional discomfort, increase in blood pressure, and heart rate. And here's a big one. If you have certain mental health histories, especially bipolar disorder or a personal family history of psychosis, psychedelic experiences can carry higher risk and are often considered contradicted or high caution because they can potentially trigger mania or psychosis in vulnerable individuals. Also, people can feel really raw afterwards. Sometimes it's relief, sometimes it's emotional turbulence. That's why in research and regulated programs, there's emphasis on screening. What does a supervised session actually look like? A lot of people imagine mushrooms like a super casual thing, but it typically includes prep sessions, the dosing day, and then integrated sessions afterwards. On dosing day, it involves a comfortable room, which is often designed to feel safe, not clinical, a trained facilitator, and you're given eye shades or music. This experience doesn't happen in just 30 minutes. It typically unfolds over most of the day. The goal is not to perform or talk the entire time. Often the goal is to let the experience happen and then later make meaning of it with support. If you've lived through trauma, here's what I want you to know. Psilocybin can sometimes bring up vivid memories, body sensations connected to past events, grief, fear, shame, or emotions you've had to suppress just to survive. That doesn't mean it's bad, but it means you deserve safety, structured, and trauma-informed support, not someone casually dismissive or hyper-driven. A trauma-informed approach means you're not forced to relive everything. Consent matters constantly. You can pause, stop, or redirect. and your nervous system is treated with respect, not pressure. This part is really important. Psilocybin is still illegal under U.S. federal law, even if some states create regulated access programs. Like in Colorado, there is a state-regulated natural medicine framework being built and implemented through state agencies, including licensing and rules for regulated services. So if you're in Colorado, the safest direction to explore is regulated or licensed pathways and credible providers operating within the law, not underground pressure or sketchy situations. And if you're not in Colorado, laws vary widely. Always check your state and local laws first. Remember to talk to your doctor and use extra caution and professional guidance if you have a history of bipolar disorder or psychosis, uncontrolled high blood pressure, or serious heart issues, because blood pressure and heart rate can rise, or if you have active substance use issues without support, or if you're in a highly unsafe environment, or if you're on psychiatric meds and unsure what interactions can occur. This is doctor territory. This doesn't mean never, just talk to your doctor. Here's the heart of it. Psilocybin therapy is not a magic fix. It's not for everyone, and it's okay if your nervous system says, this feels like too much. You're allowed to be curious, cautious, not interested, or somewhere in the middle. If you're considering it, you deserve real screening, trauma-informed support, legal clarity, and a plan for integration afterwards. Because your healing is not a trend, it's your life. If this resonated with you, subscribe for more honest, trauma-informed support and visit www.thediamondplace.org for resources and real talk provided by survivors.